Hi everyone, I hope you're doing well and are having a flare-free day. Thanks so much for coming to my channel. In today's video, I wanted to talk about something that's very important, but often underdiagnosed and misunderstood and labeled as somebody just being emotional or irritable or angry. There are different levels and stages to the menstrual cycle, from ovulation to actually having your period. And during that time, oftentimes in society, when someone is being a little bit more emotional or irritable, it's labeled as, oh, they're just PMSing, or they're just being more emotional because their period's around the corner. We see this in society all the time of, oh, they're just PMSing, or oh, she's on her period, or oh, whatever statement may be. There's something deeper happening. There's actually evidence and facts and research behind the emotional changes that happen during and throughout the menstrual cycle. There are emotional and physical responses and symptoms related to PMS that are, again, evidence-based, fact-based. They have tons of research behind it, but oftentimes it's just labeled as they're just emotional or irrational or fearful of what's going on because of their period. But in today's video, I want to talk about something that's more severe that happens during a menstrual cycle and someone's period. And it's called Premenstrual Dysphoric Disorder, also known as PMDD. PMDD is a serious condition, and it can have drastic impacts on somebody's quality of life, and it can impact their emotional and physical well-being. And it's not talked about as often as it should. So PMDD is going to be the topic of discussion for today's video. I'm going to talk about what it is and how it's different than PMS, which is also a natural occurring thing that happens. I want to talk about the symptoms related to PMDD, as well as how it can be diagnosed and how it can really impact somebody's quality of life and can be a very serious disorder that needs to have more light to it. So if that interests you, then please keep on watching. So premenstrual dysphoric disorder, also known as PMDD, is a cyclical hormone-based mood disorder where symptoms occurred before the time of your period, typically 7 to 10 days before you actually have your period. This is known as the premenstrual phase or luteal phase of your cycle. After the time of your period, the symptoms related to PMD often subside. So once you actually shed and bleed, that's when the symptoms kind of ease up a bit on the individual. PMDD is said to impact 5 to 7% of the menstruating population, which is not a small number when we actually think about it. With that information in mind, and being in Canada, that's around 475,000 individuals that are impacted by PMDD. For the US, that's 4.2 million individuals. For the UK, that's 824,000 individuals. So try filling a room or a lecture hall with 475,000 individuals. You would say, wow, that is a lot of people. So 5 to 7% may sound small in the percentage range, but when we break it apart and look at it in those numbers, that is a lot of individuals suffering potentially in silence. While PMDD is directly related to the menstrual cycle, it is not a hormone imbalance. It's a severe negative reaction to the natural ebb and flow of estrogen and progesterone. Now, when compared to PMS, also known as premenstrual syndrome, it's a word that we often hear more of in society when compared to PMDD. PMS is often used in the population or society or pop culture as, again, that labeling emotional impact of, oh, they're just being hostile, irrational, or irritable because their period is around the corner. Clinically, PMS is a collection of emotional and physical symptoms that occur during the time of your period. And there are symptoms such as bloating, tender breasts, increased hunger, irritability, and a range of emotional changes that occur within the individual. Now, an individual with PMS may have fewer or less severe symptoms than those with PMDD. Now, PMS is more common than PMDD, and I don't know if that's because there's a lack of research on PMDD or if that's just the general case, but more than 80% of the menstruating population around the world suffers from PMS symptoms related to emotional and physical symptoms. Those symptoms of PMS do range from mild, moderate to more severe cases. PMS can definitely interfere with someone's quality of life, their ability to go to school or work or do the things that they want to do. And it can also have an impact on someone's interpersonal relationships with other people. However, when compared to PMDD, PMS symptoms are more generally understood and easily managed when compared to PMDD symptoms. Right now, currently, PMS is also not considered to be a mental health condition or illness, where PMDD is. While PMS and PMDD may be used interchangeably within society and pop culture and discussions around someone's emotions during their menstrual cycle, they are different. The diagnosis is different, treatment is different, severity is different. It's important to use correct terminology when discussing this so that awareness, education, and treatment can be used effectively. Now, to formally be diagnosed with PMDD, there is a set criteria. To formally diagnose PMDD, there is a diagnostic chart that exists, and I'll put it down in the description box below when you have more time and you're in the headspace to look at it. But in order to have a formal diagnosis for PMDD, 5 of these symptoms must be present in order for the diagnosis to be made. 1 or more of the following symptoms must be met: mood swings, feelings of irritability, suddenly sad or tearful, or increased sensitivity to rejection, or marked irritability or anger during conversations with somebody, sense of hopelessness, self-deprecating thoughts, anxiety, tension, feelings of being on edge, and 1 or more of the following symptoms must be met as well: decreased interest in usual activities, difficulty concentrating, lethargic or loss of energy, marked change in appetite, specific food cravings, overeating, hypersomnia or insomnia, sleep pattern changes, sense of being overwhelmed or out of control, and physical symptoms such as breast tenderness, joint or muscle pains, a sensation of bloating or weight gain. There's an increased sense of interference with work or school or the things that you want to do. So what causes PMDD? It's believed to be hereditary, seen in families and twins. Studies suggest that those with PMDD, circuits within the brain may react differently to changes in estrogen and progesterone, specifically before the time of your period. This could be due to atypical brain reactions during the luteal phase of your period, so the time right before you actually have bleeding. And that's due to changes in the progesterone metabolite known as allo. In 2017, research outlined that those with PMDD have a more sensitive, negative reaction to the natural ebb and flow or fall and rise of estrogen and progesterone. There is ongoing research related to PMDD and the potential cause of it, but for research right now, this is what we know. There's a personal impact when it comes to PMDD, and that's why I wanted to talk about it in today's video, because again, society can just label and be easy to just disregard actual emotional, physical changes in somebody's body, especially those who menstruate. And taboo topics in society aren't talked about enough because, again, they're seen as dirty, or I don't want to talk about it, or that's gross, or it's a period, and it needs to be talked about because there are severe impacts to somebody's emotional well-being when it comes to PMDD. When it comes to PMDD, the emotional impact of it can be so severe that individuals can be found in a depressive or anxious state that leads to suicidal thoughts or self-harm. 72% of individuals who have PMDD report thoughts of suicide. That is much higher than the general population. Symptoms of PMDD can be debilitating and obviously have an impact on somebody's quality of life. On average, it takes about 12 years to receive a formal diagnosis for PMDD. When I've been on this YouTube channel and talking about endometriosis and other chronic disorders that have painful periods or menstrual cycle symptoms as a symptom of the disease and disorder, it seems like there's a common trend and a common thread that it takes on average more than 5 to 8 years to receive a formal diagnosis. Not sure if it's just because it's a menstruator's disease or disorder, but it needs to change. Patients with PMDD saw an average of 6 medical providers before they received a formal diagnosis. This is where I say research is needed because it's truly unknown how many individuals are truly suffering with PMDD due to a lack of research, understanding, awareness, or the societal taboo that what you're going through is normal emotional changes because of your period. Daily symptom tracking is a really important step, and you can also start tracking your menstrual cycle basically 10 to 7 days before your period. If you're noticing any of the symptoms that I've talked about in today's video, it's really important to write it down in a journal or go talk to your medical provider that you feel comfortable with and say, these are the symptoms I'm experiencing. Can it be related to PMDD? If you're not feeling supported by a medical provider when you bring forward these symptoms and you bring forward this tracking data for yourself, it's important to recognize that there are other doctors out there that will support you and will hear you and that you are not alone. It is a common thing that happens with individuals who menstruate. And so if you're being dismissed or ignored, or again, that statement of you're just one of the unlucky ones that has really bad PMS, that's not the case. People need support. I can only imagine what you are going through, regardless of the severity of your PMDD or PMS that you live with. You are deserving of answers, and you are deserving of someone that listens and supports you throughout this journey. There is no single experience when it comes to PMDD. There is a range of mild, moderate to severe cases, and everyone's body is beautiful and unique and different, meaning that symptoms may present differently for you and your body. Now, when it comes to the treatment of PMDD, there is no right or wrong approach, as PMDD symptoms, again, can range from mild, moderate, and severe. It's really important to talk to your doctor, medical provider, or general practitioner to talk about your symptoms and experiences with PMDD before diving into treatment options that you take on yourself. You really want to make sure that you have a medical provider and team behind you to make the right decisions that work for you and your body and other existing medications that you might be on. Just a little disclaimer that this video should not be taken as medical advice, and again, you should seek medical advice before self-treating yourself to any of these symptoms. Self-care skills for PMDD include lifestyle changes, including diet and nutrition, as well as moving your body, physical exercise, and taking on lifestyle skills that reduce stress. So whether that's walking outside in nature, listening to your favorite music, yoga, deep breathing practices, these things can support PMDD symptoms. Cognitive behavioral therapy can also be supportive in PMDD cases, and certain supplements can be supportive of PMDD as well. Some supplements that you may want to talk to your doctor about when it comes to PMDD management is vitamin E, vitamin D, vitamin B6, magnesium, calcium. An increase in fiber can be really supportive too. Those are just some of the options that I've come across in my research. But again, it's really important to talk to your doctor to see if there's other medications out there that do support PMDD cases. I am so proud of how far you've come in your journey. I can only imagine the toll of the emotional impacts and physical impacts that this disorder has on an individual. I myself live with endometriosis, and there are similar symptoms such as the chronic pain, the chronic misinformation around the disease that you have, the lack of diagnosis and support found in the medical system. And it can sometimes be really disheartening on some days when you're trying to find answers and resources and you're just feeling like you're hitting a brick wall. But I want you to know that you're not alone and that there are so many people around the world that are with you. And the more we talk about it and raise awareness, I hope that one day it won't be seen as a taboo topic, and it won't be seen as a topic that we don't talk about with our friends and family or society. I have hope that one day society will see periods as a topic to actually talk about nicely and not just laugh it off as they're just emotional because they're period, and it downgrades someone's actual lived reality with the intense physical and emotional changes that happen during a menstrual cycle. Please keep putting one foot in front of the other to find the right doctor that believes you and supports you. Again, with the same support group of friends and family that sees you and supports you. You are deserving of it. And with this, I hope that this information has helped shed a little light on PMDD. If you or somebody you know live with PMDD and feel comfortable to comment down below your experience, please feel free to do that. I'm sure it will help somebody else feel less alone and less afraid of what's going on when they have their first symptom or experience of PMDD. With that, I hope that this video has helped, and I cannot wait to talk to you on the next one.